the 17th day of November, Triumph Uganda, under the leadership of Robina Nakanoa Jealambuya, the Executive Director, has organized a policy dialogue with major stakeholders, especially in the government and the private sector, to discuss issues around inclusive reproductive health services for young girls, boys, adolescents, and women with psychosocial disabilities. Sexual and reproductive health for women and girls with psychosocial disability is a critical issue and a development concern that requires urgent attention and priority. Persons with psychosocial disabilities in JINJA constitute about 6,000, and they experience several challenges with sexual and reproductive health services. They do not get adequate information about sexual and reproductive health services because society thinks they do not need the services. They experience a lot of violation when it comes to forced sterilization, abortion, and forced contraceptives without their informed consent. Their will and preference is not given adequate attention when it comes to access to sexual and reproductive health services. Some of them are unable to access maternal, antenatal, and postnatal care, sometimes due to poverty, due to far distances in terms of health services, and due to lack of community support when it comes to people with psychosocial disabilities. The other urgent matter is with regard to sexual violence, whereby little support is got from the law enforcement officers, including the police, the justice sector, the lawyers and judges, especially where they believe that people with disabilities are of no use. Today, we have asked a number of stakeholders to commit to supporting persons with disabilities, and at least with psychosocial disabilities, and at least to do something different to bring about fundamental change and social transformation. Community development officers, nurses, doctors, police officers, parents, and district COW have committed to support the inclusion of people with psychosocial disabilities, especially in the attainment of poverty eradication, sexual and reproductive health services, as well as psychotropic medicine. We urge the government and all the stakeholders concerned to prioritize the needs of people with psychosocial disabilities, especially with regard to sexual and reproductive health services. First of all, as people with psychosocial disabilities, we are human and we have sexual desires. We need to make choices as to when to have children, how to space our children, and how to get married. Our major concern is love and not to be depressed. We speak against discrimination, stereotypes, and stigma in society. We call upon everybody concerned to include us in all activities, policy making, programs, implementation, and budgets of the of the district where we come from. I speak this as Ndagire Florence, the expert on mental health and disability for God and my country.
On behalf of JINJA District and ECOW's office and COW's office, allow me to thank Triumph. Thank you so much for coming up with such a brilliant program to see that our children who have always been looked at behind, like we don't ask, some parents are so funny. They don't want even to associate with their very own children. And we are here, seated comfortably. So I want to thank you so much for having developed and nurtured and loved these children. Thank you so much. Ladies and gentlemen, we must accept that socio-psychological disabilities in society are still a very big challenge. They are faced with discrimination and they come with a lot of stigma. Some of us here don't even want to associate, even deal with people whom we think have some psychological challenges, forgetting that every human being is mentally challenged according to the percentage. So all of us here are very good candidates, and even we are candidates. So we must take this thing seriously, and we must give it the attention it really deserves. And as JINJA district, I want to assure you that we are in the struggle with you. We have programs, we have a rehabilitation officer, and I'm so glad that Madam Diana is here. She has taken off time to come and sit with us here because she's in the department which deals with some of these challenges. We as government, we are very sure that the little we get from government, from the central government, is actually shared with our people who are challenged with mental health. I've also advocated for their rights in one way. We have liaised with Mama Police, and we worked with the security to see that these children are protected just like any other human being. And I want to pledge our support that as JINJA district, we shall always and we shall continue supporting our children, our women, our men who are mentally challenged.
I'm Detective Assistant Superintendent of Police, Kasoga Sylvia, in charge of Criminal Investigation Department, JINJA Central Division, CPS. First of all, when we receive victims of sexual violence, especially persons with disabilities, we first look at your needs. What do we need? We have those people who are dumb. We need translators. That is number one. Because some of us, we may not know how to interpret. So we have to get an interpreter who understands the language that that person with a disability can easily express him or herself. Two, we normally take these victims of crime for medical examination. And where need be, we refer them to counselors. Sometimes persons with disabilities are discriminated by their parents. And sometimes when they get such issues, parents tend not even to care. Like, after all, there is nothing much. I cannot benefit from this person. But what do? We have NGOs which we normally work with, but through the probation officer, we normally refer those people for psychosocial rehabilitation. But we commit ourselves that we shall always investigate these matters to their logical conclusions.
She's a Dorcas, a mother to one of the daughters, and Triumph. My daughter got a challenge when she was in age 3, adolescent stage, and we've been supporting her as parents from then up to now. It's not an easy challenge that you go through. People look at you as a parent who has failed, and you have to stand to that test. However, what we did was to pray and believe God and support our daughters, no matter what the challenge was. And so, in this meeting, as a parent, on behalf of the parents, we are committing ourselves to make sure we have a peer group of parents so that we can sensitize other parents. Because we've been informed that parents tend to have negative attitude towards the children with mental disability. But I'm here committing myself on behalf of the parents that we are going to support our children, sensitize others, and be able to advocate for them. I'm also requesting the communities to accept the parents, accept the children who have children who are disabled. Because when you neglect us, talk negative things about us, we also feel shy and we may not be able to support the children. So we request the communities to understand that we are also people in the community who have feelings and we need your support. So we request that the community support us when we come to you.